Cervical cancer is a significant health concern affecting the cervix, the lower part of the uterus that connects to the vagina. Cervical cancer primarily results from persistent infection with high-risk types of human papillomavirus. Other contributing factors include early sexual activity, multiple sexual partners. Smoking increases the risk of HPV-related cancers. Weak immune system due to HIV/AIDS or immunosuppressive therapy. Long-term use of oral contraceptives. History of sexually transmitted infections like chlamydia. And family history of cervical cancer. Early stages of cervical cancer are often asymptomatic. As it progresses, symptoms may include irregular vaginal bleeding after intercourse, between menstrual periods and after menopause. Unusual vaginal discharge that could be watery, bloody, or foul-smelling. Pelvic pain or pain during intercourse. Advanced symptoms may involve leg swelling, difficulty urinating or blood in urine, fatigue or weight loss. The diagnosis of cervical cancer often involves screening tests such as Pap smear to detect precancerous or cancerous cells, HPV tests to identify high-risk HPV strains. Other diagnostic procedures include colposcopy, a detailed examination of the cervix using a colposcope. Biopsy includes punch biopsy, endocervical curettage, and cone biopsy. Imagings that can be done include ultrasound or MRI to assess tumor size and local extent of disease, and PET scan to assess for pelvic and para-aortic lymph node involvement. Chest X-ray and radiograph of the skeleton for evaluation of lung and skeletal metastases. Lab investigations include complete blood count to detect anemia from chronic vaginal bleeding, urea, electrolytes, and creatinine to assess kidney function and electrolyte balance. Liver function tests to identify liver metastases through elevated enzymes or bilirubin. The International Federation of Gynecology and Obstetrics staging system is used to determine the stage of cervical cancer and the best treatment plan. Treatment depends on the stage of the cancer, overall health, and patient preferences. Early stage treatments involve surgery, conization or the removal of a cone-shaped section of the cervix, hysterectomy or removal of the uterus, and radiation therapy may be combined with chemotherapy in certain cases. Advanced stage treatments involve chemoradiation, a combination of radiation and chemotherapy. Targeted therapy such as bevacizumab that inhibits tumor blood vessel growth. Immunotherapy for recurrent or metastatic cases. Prevention of cervical cancer involve HPV vaccination that is recommended for both males and females, ideally before the onset of sexual activity. Regular HPV tests as per guidelines. Lifestyle changes such as smoking cessation and safe sex practices, and early treatment of precancerous lesions. And that's all for this video. If you find this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.